Good morning, everybody. I'm Dr. Sue with ArtLipo, and this is Genevieve. How you doing?
Very good.
Good. So here at ArtLipo, we do a lot of lower extremities, and one of the things that very few doctors do is the ankle area. We refer to that as Cankles. But one of the things that I do in addition to the Cankles is the knee in a very complete way that we call the knee complex. So basically, we'll be treating here all the way up to halfway up the thigh, because that's really what has to happen to make a nice difference for many of our patients. Not everyone, but I would say the majority of our patients, we need to treat that entire area to get a slimming effect of the entire leg. So one of the things that we'll be talking about today is lipedema. You're going to hear us talk about lipedema, which is a fat disorder where the fat is painful. And it's actually a disease that a lot of doctors don't even know about this because it's a relatively new diagnosis. But I'm going to let Genevieve tell you about what's been going on in her life and how this has affected her.
So I guess this year I'll be 50. So my journey, I think, started when I was, 10 or 11, and I was always the heavy one. And because I have two sisters, and my sisters don't have this issue. So it was even more pronounced in my life because, everyone looked at the three of us, and I was obviously not doing what I should because I didn't look like them.
So you gotta get blamed, or
right.
It was like your fault or something?
Yeah, that you're eating too much, you're sitting around too much, you're lazy, you gotta just, be more active.
Yeah.
So it progressively got worse, even though I was very active. And after having my third child, I decided by the time I'm 40, I'm going to be the perfect size and be great mentally, physically. And so I started working out, and then that brought me to more bodybuilding. And I actually did a bodybuilding competition about 4 years ago. And my upper body responds amazingly. My lower body, I do have, a muscular lower body, but there's this layer of fat that does not go away. And I really had no idea.
Would it be okay if we included a photo of that one that you showed me?
Yeah.
So we can put that in there for everyone to see?
Yeah, because I think it's important for people to understand. I went to probably 10 different trainers trying to give me diet, exercise, cardio. Don't do cardio.
Yeah.
You're doing too much cardio. Do more muscle. Go on a vegan diet.
Yeah.
Do keto. I've done everything.
Right. When I saw your photo, everything from kind of upper thighs up, you looked like you had less than 10% body fat, and everything was ripped.
Probably at that time.
Yeah, but down in your legs, it was still thicker looking.
Well, I was telling Rochelle on Friday I had a DEXA scan, which gives you pretty accurate body composition.
Yeah.
So my upper body, I have right now 12% body fat.
Okay.
My
very
lower,
low, very, very, very low.
My lower body is 33% body fat. So obviously there's a problem.
Yeah.
It's not it's not working out, and there's no way that I'm only working out my upper body and I'm lazy, and that's what I have.
So what did you discover in your journey here about lipedema and how this is really it's an explanation,
right.
But I
had accepted that this is just my body, and we're in an era, don't body shame people. This is, and so I kind of just accepted that that's how it is. But I started having pain in the back of my calves and my lower legs. So I went to the doctor, and she diagnosed that I do have this disorder, and that there's absolutely nothing that I could do. And she suggested that I do massage therapy and compression hose, and there's also an alternative that you could have liposuction, but you should try these other things first. And I said no.
Yeah, well,
so
you've been trying things all your life,
right,
and to extremes. Most people don't even get into bodybuilding and that kind of thing. So. And
so I met with you 2 weeks ago, and here I am today.
Okay. So you had done some research and found some lipedema websites.
Right.
Once you found out about it.
Lipedema websites, and then it's been a full-time job for the past month, looking at different surgeons and what type of surgery and what type of even liposuction. Yeah. And I was very impressed with your expertise and knowledge and the way that you look at it aesthetically, but also to relieve the medical condition.
Right.
So
yes,
that's why I'm here.
And so some of you out there have probably already done your own research on lipedema. There's a lot of different information, but I would say if we boiled it down to the basic information, it is painful fat that mostly affects the lower extremities. It can be everything all the way up to the upper thighs, but the women who have it typically have a very significant mismatch of the proportion where the lower leg ankle area is usually a lot thicker and may have cuffing. The fat is usually most tender, or patients also describe a very heavy sensation, which Genevieve, told me about. That's as significant, that the legs feel very tired and heavy all the time. This can also affect the arms, and about 30% of women also have thicker fat right here, which can also exhibit some of those symptoms. Anyways, it's pretty well documented that liposuction, removing the fat very completely, can halt the progression of lipedema, which can be very progressive and debilitating, and it also relieves the symptoms very, very well. I hesitate to say 100%. I would say most of the symptoms are gone in the patients that we treat. So anyways, do you have anything else you want to add?
I'm just so excited. I can't wait.
Awesome. So without further ado, we will get on with this. I'll just I'm going to show you guys. So I'm just going to show you Genevieve's upper body first. Do some poses for us. Yeah, chest, arms. Oh my goodness. Okay.
Back is good.
Yeah, let's do the back. Okay. This lady is cut and ripped. Okay. So now I'm going to stay right there. Okay. And I'm going to show. So now let's bring the legs a little bit apart. So now that I'm just showing legs, you can see how there's a mismatch. Okay. And then turn around for us. Okay. So these do not look like the thin upper body that Genevieve has. Anyways, by today, the end of today, we're going to remove what has not been possible for her to work off, because we didn't talk about it specifically, but lipedema fat does not respond like normal fat. Normal fat is metabolically active. When you exercise and you burn calories, typically those regular fat stores are utilized. Lipedema is not. So all throughout Genevieve's lives, from time before you were pregnant and everything else, you were active and it just never went away. It's just very inactive fat. And throughout life, as hormones change and we have different hormonal shifts, pregnancy, menopause and things like that, that's when lipedema can really accelerate, and that's what you've been experiencing, right?
Yeah, and I just didn't want to get to the point where it's a huge issue, because it's progressive, it doesn't stop.
So that explains, I hope that explains to you guys out there why all your efforts don't seem to really work, especially someone like Genevieve, who puts so much effort into actually competing, and you can see that she's been able to tone her upper body like nobody. Like very, 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 very few women can, and yet her legs have never responded. So we're going to change that all. Okay, and you can too. Okay, thanks. Hey Genevieve.
Hello.
How you doing?
Actually very much better than I thought it would.
Okay. Well, to our viewers, we just finished one leg. She has not gotten to see anything. I'll give you just a little sneak peek here. Okay. All right. You come on, stand up, and if you get lightheaded, let us know because people can get a little lightheaded here.
Oh my God, that's insane.
They look like your leg?
This one, yeah.
Yeah.
Oh my God, that's so great.
Okay. So, yeah, you can tense it up. Look, you got some quads. And do this.
Oh my God, that's insane. I don't think I've ever seen my leg like that.
Turn and face me a little bit.
I mean, it's not looking pretty, but
Yeah, you are.
it looks a lot.
Let me see your back. Let me see your back.
That's insane. That's exactly what I was hoping for. And it's honestly, it's
Okay.
like
You're already bleeding some here, so I'm going to just have you take a quick peek here, and then I have to stop that bleeding, okay?
yeah. No, I'm good. I think it's stop.
Okay. All right. Okay, Genevieve, you want to come on over here and take a look?
Oh my God. That's insane.
You wipe it.
Okay.
You feeling okay?
Yeah, no, I feel great.
Okay. Hey, you want to sit up?
Yeah.
Okay. I got a little lightheaded. Go and sit up and take a look. They look sleek
Yeah.
and toned, right?
It is so weird. It's like so different. I can't believe that. Like, oh my gosh, I look like one of my sisters.
Lay it down. And I bet lay your legs down. You can stay sitting up, just lay it. Yeah.
That's insane. I have never, ever,
You
ever.
have cut calves
Yeah,
and a little thin knee,
oh my
right?
gosh.
And little thin ankles, right?
Yeah.
What do you think?
I'm in shock.
You can
I
look
can't-
up here.
Like I
You can look up here.
had expectations, and you were like kind of playing it down, like, oh, you'll get a good result. This is incredible. It's amazing. Whoa.
Okay. Say goodbye.
But,
Or actually, you want to tell them anything about how it was?
it was definitely worth it. I'm not gonna say it wasn't painful. It was painful, but it
Not
was,
not easy though, huh?
No, not easy, but not too much.
Yeah.
It's
Well,
not
you don't
as-
have to downplay it. I mean,
No, I mean I've had
there's some tough parts of it, right?
yeah,
Okay.
but it's bare. I mean I've had 3 children, 2 of them without any painkillers,
Yeah.
and this wasn't that bad.
Okay.
If that's a good.
But worth it,
reference.
right?
It definitely. Oh my gosh, definitely worth it.
Okay. All right. Say bye-bye.
Bye.
Bye-bye.
Thank you, Dr. C.
Okay.